So the new initiative I'm going to try to do during my year is to try to see if we can get together kind of a blue ribbon panel of everybody involved in clinical trials and research, mostly in the US, but of course worldwide. And that would include the researchers, the data managers, the research nurses, people from the FDA, people from pharma, people from contract research organizations, everybody really involved in clinical trials, and try to come up with best practices to try to streamline really what's done. I think there's a lot of duplication, there's a lot of things that are done that perhaps really don't need to be done. So we want to come up with a kind of a minimum viable product, if you will, that really is going to be best practices in clinical research and kind of a structure to try to go forward with that, so that we can try to decrease the inefficiencies, decrease the cost of clinical research, and really have a lean, mean machine to be able to do that everyone could go by to try to see if we can improve the clinical research activity and get things done in a much more efficient manner. Well, I would say that we would also have some patient advocacy groups or representatives on this blue ribbon panel to be able to make sure that their voice is heard and that we can include that. You know, they have a lot to say about this, obviously, and we want to make sure that their voice is heard as well, and that their best practices from the patient's viewpoint are also included in what we do.